I'm Dr. Michael Allen. I'm the author of the books Receptor-Based Solutions, Functional Neurology Every Doctor Should Know, and What Your Brain Might Say If It Could Speak. Both of those books talk about how the brain works, and we're here to talk about the cerebellum today. So stay tuned, and let's put together some information to help you treat your patients at a better degree. Talk today about the cerebellum and doing some very successful and easy cerebellum examinations. And the more you're comfortable with the cerebellum, the better is going to be your response to treatment, because that cerebellum is essential to muscle function. And as applied kinesiologists, we deal with muscle function, and every applied kinesiologist should know more about the cerebellum. The cerebellum exam is so important to the physical examination of your patient because it tells you more about muscle function on the side of cerebellum involvement. You see, the cerebellum receives signal from muscle only. It doesn't receive signal from joints. The signals from muscles go just to the cerebellum, but the signals from joints go to both the thalamus and the cerebellum. So the cerebellum is very important in muscle function, and in order to understand those muscles and how they work to keep structure intact, we have to understand more about the cerebellum. The cerebellum is based not only on sensory input, but also motor response. And the motor response from the cerebellum is basically the balance of the lower body and purposeful movement of the upper body. The cerebellum examination is relatively easy. You just look at what side is working and what side is not working relative to normal and go from there. So for example, if a person has a dysmetria, if they miss their nose when they try to touch it with their finger, that's an indication of a cerebellar exam on the side of dysmetria. If a person has dysdiadochokinesia or fast alternating movement issues where one side is slower than the other, you might say that this cerebellum is not working to the same extent as the one on the opposite side. So these are two examples of cerebellar dysfunction, and knowing the side of the cerebellum dysfunction can help you understand which side of the patient needs to be treated, which side of the patient needs the adjustments. Because if you stimulate muscles on one side, you stimulate the cerebellum on that same side, and that strongly affects the cortex contralaterally. And when that cortex is affected, it goes back to the side of involvement as well as stays on the same side to help control motor response. So the cerebellum exam is very important, and when we learn more about the meaning of the cerebellum exam, you're going to understand more about how to treat your patients appropriately, and you'll get a better response. We're going to talk about lots of other cerebellum exams and what they mean. You're going to be able to apply them Monday morning when you go back to practice. I think it'll make a big difference on even when it comes to sidedness of treatment. So let's have some fun at that examination discussion, and we'll go move forward from there.